Kenyatta has urged healthcare service providers in the country to prioritize palliative care and include it as part of their primary healthcare package. Lady Atieno with an in-depth.
Official launch.
The policy is anchored on advocacy and communication, leadership and governance, service delivery, availability and access to essential medicine, human resource and education, health information systems, and healthcare financing. At least 47,000 patients are diagnosed with cancer annually, with 27,000 dying every year. 70% of this entire population are diagnosed during the last stage and will need palliative care, with only 14,552 getting the care.
About 47,000 patients are diagnosed with cancer in Kenya annually. And of this, about 27,000 will die. The majority of those diagnosed with cancer, 7 out of 10, are diagnosed during the late stages of this disease and will need palliative care.
Speaking during the launch of the palliative care policy, First Lady Margaret Kenyatta pointed out that this exercise will improve service delivery and create a template for affordable management and treatment, streamlining health delivery.
The National Palliative Care Policy that we launched today will go a long way in shaping how Kenya delivers this care. The new standards, guidelines, and protocols will determine how this care is integrated and implemented. Adequate application of resources and research will build a wealth of evidence of palliative models which may be applied in our country and through specialized training enhance the quality of service.
Despite the launch of the policy, hospices in Kenya are still facing challenges, with relevant stakeholders proposing new strategies to support the sector.
We need goodwill from the training institutions as well. One of the things that we are told, especially, and I feel very sad when our patients are told that, they're told we do not have staff who are well trained. We also would need a little bit of goodwill from institutions of higher learning on research. As you roll out the UHC program, we want and we would like to request that palliative care patients become automatic members of the UHC program. We also want to request that NHIF gives us a little bit of goodwill.
We need to talk about how do we finance palliative services? What is the role that NHIF will play?
We're appealing to the Ministry of Health and the Metropolitan Services to consider additional secondment of staff to the hospital.
To complement the policy, the Ministry of Health is expected to launch 9 more cancer centers and the Council of Governors to support palliative care centers in their counties.
The issue of infrastructure. Within the few coming months, we shall be able to launch cancer centers across the country. We have 9 of them that are upcoming in terms of launch and to ensure that they're operational.
We should continuously seek to improve access to quality palliative care services and break down various barriers like financing of palliative care services.
Lady Atieno, TV 47.